Well, many people have decided to stop using face masks because they claim COVID-19 is no longer with us. But that is where they can be ambushed by the disease and other respiratory infections, especially in the dry Harmattan season. In this report, Love FM's Anita, Serwaa, Adjoga, and Emmanuel Quaicoe look at how face masks are crucial now and even in the post-COVID-19 era.
A box of nose masks, which contains 50 pieces of mask, was sold at 25 to 30 cedis last year. Today, a box goes for 7 cedis. One nose mask was sold at 1 cedi, but traders now sell 3 to 4 pieces at 1 cedi. Veronica, a nose mask vendor, says patronage has been really slow. According to her, many have stopped buying the mask because of the vaccination.
They said the nose mask in the they said almost they said the and Quaicoe so ma wo pani and tomu wo pani anya do me say use nose mask.
Flus are highly contagious respiratory diseases caused by viruses infecting the nose, throat, and lungs, resulting in coughs, sneezes, and fever. This often occurs during Harmattan, where dry and dusty wind blows in late December till February. Dusty winds pollute the air with particles during Harmattan that can hinder breathing, and this is a perfect sidekick to COVID-19. Compared to rainy, cooler, and drier seasons, the Harmattan preserves COVID-19 for longer in the air and on surfaces. Harmattan dust intensifies bronchitis, a pre-existing breathing condition that intensifies COVID-19. One of the ways to protect the respiratory system against acute respiratory tract infections during Harmattan is the use of a nose or face mask. Unfortunately, people have stopped using the protective mask.
Yeah, I'm still 2 years, 3 years, man, fine. In Titamana, Nan Arabia, and I'm from Mukoni Bemo. I don't know, the nose mask, and then can walk 50 and I'm over so they are, can die. Nancy, I see nose mask and never boy and home by the American to Musa.
Nyanga sana me bacteria free, virus free near nose mask ne near the end. Mimi nya shepe na katachim. Nyame fort.
Oh, media mean shit. Because as a COVID no airborne. Because I overheard the way and go for crash show more nose masks and crime from a quite room. In this whole beer, I am infected with COVID. Definitely, you are also going to get infected. Nose mask in there will do our bonus mask better, so Benya, nose mask the more and
Research by the National Library of Medicine reveals acute respiratory tract infections are the leading cause of morbidity and mortality in developing countries, especially in Africa. Out of 1,213 recruited, 12.4% were positive for one or more of the human coronaviruses. Single virus detections occurred in 12% and multiple detections occurred in 0.3% of the population. It was also revealed that human coronaviruses were found to be seasonally dependent, with significant detection in Harmattan season and wet season. Dr. Michael is the lead scientist.
You know, there was some correlation between season and then exposure and maybe infection eventually with these viruses. So our findings was that especially the dry Harmattan season was possibly a precursor or could pose as a risk factor to transmission of these 4 human coronaviruses. This is the Harmattan season. The pre-Harmattan season, there are other viruses that could cause infection. These are rhinoviruses or sometimes influenza viruses. But in the Harmattan, you mostly have coronaviruses and sometimes influenza virus A. This is the dynamism we use.
The virologist advises the mask should be worn every day even after the global pandemic is over. According to him, the mask will not only prevent COVID-19 but other respiratory diseases.
Almost all these respiratory organisms are transmitted through the nasopharyngeal portal. And it's not just viruses, or bacteria that cause meningitis. We have Streptococcus pneumoniae, we have Neisseria meningitidis, which normally cause outbreaks in the north and sometimes even within the southern part of Ghana. These are all transmitted through respiratory droplets and also nasal droplets and through coughing and sneezing. So if individual can cover the mouth, I mean, when in large gatherings or in crowded area, you have a chance of preventing not just viruses but bacteria, and you can end up reducing meningitis outbreaks, I mean, in different parts of Ghana, and many other viral outbreaks in Ghana.
Anita, Serwaa, Adjoga and Emmanuel Quaicoe's report read to you.